My name is Billy McKee. I'm Director of Imaging at Henry County Medical Center. February is Heart Month, and again, we want to focus on screening our population. We have a couple of different ways that we're able to screen. We have our new CAT scanner at the hospital that does calcium CT scoring, which allows the radiologist to look at the heart and see if there's any plaque buildup, and it gives you a number so that you can kind of scale whether you need any further evaluation. It's a very good process. We also offer ultrasound vascular screening. This procedure actually looks at 3 different areas of the body. We're able to look at the carotid arteries and see if there's any plaque buildup there. We're able to look at the abdominal aorta to see if there's any thickening. So again, that could be a sign of vascular disease. We also look at the legs, the peripheral arteries, to look at blood flow, see how much pressure are in the legs. Again, that's another sign that you could have some vascular disease going on, and you're able, to kind of catch that ahead of time, and that's a good screening tool to be able to do that. Currently, you do not have to have a physician referral or an order to have any of our vascular or CAT scan screening exams. It is always best to talk to your physician if you have any questions, especially if you think that you meet some of the risk factors, just to make sure that this is a test that you feel like you need, and it's always good to get their input. But no, it does not require a physician order. Most procedures take less than 30 minutes. You're able to come in. There's no special prep for any of these exams. You're able to come in, we put you in a gown. It takes about 15 minutes to lay down on the scanner and scan the CAT scan. The vascular screenings may take a little longer depending on the areas, that if they look at all 3 areas. But typically most exams can be done within 30 minutes. We are able to keep the cost low on these exams because we want everybody to have access to these life-saving screenings. The CAT scan costs $99, and the ultrasound is $125. Unfortunately, insurances do not pay for these screenings, so these are self-pay items that you have to pay for up front when you register. But again, we try to keep it as low a cost as possible so that people can afford these screenings. You will receive a letter in the mail with the results of the test and an explanation of what they mean. We always encourage people, when they get their results, if they have any questions, there is a number on there they can call us. Or again, they're more than happy to talk to any of their physicians. Our local physicians are very supportive of these screenings. They're very aware. We've done these for a long time. So like I said, most physicians are very aware of findings and what can guide you to where you need to go if you need to. If the patient does tell us that they, because typically this is considered a self-referral test because you don't have to have a physician order, but we still have physicians who write orders for these because they want their patients to have them. Or if you tell us you want your PCP to have a copy, then we will be glad to send them a copy of the results as well. Usually within 3 to 5 days. Probably a little quicker than that, but we say that kind of on average, just because we do have to have the radiologist read the exam. We do manually mail out the letters. They're not, sent through a system or anything. So within 3 to 5 days, you should receive results in the mail. You can register for these exams by calling our centralized scheduling office at 731-644-8486, option 1, and just tell them that you would like to get an appointment for either the CT calcium scoring or the ultrasound vascular screening, and they can set you up an appointment. We can actually do both tests in the same day if you would like to do that. We do have some packages available sometimes if you decide you want to do both of those, so you can always ask about that as well. We have actually been able to identify several people in our community through these screenings that had actually no visible signs or symptoms going on as far as the cardiac calcium scoring. We were able to do this screening and detect issues that were going on that maybe the patients weren't even really aware that they had anything going on. Looking back, they may say, well, I had a little bit of shortness of breath, kind of just, they kind of didn't really take those symptoms into effect, thinking that it was related to the heart. So we have had several very successful results with this screening that otherwise these patients could have very easily had a heart attack because they missed the warning signs.